The Philippine medical coding industry was established in 2010. Its initial players included less than 5 companies that provided general BPO services to healthcare companies. Pioneer coding groups, based mostly in Metro Manila, worked on a mixture of inpatient and physician practices. Clients saw the success of their initial outsourced projects to the Philippines and decided that extending their services to medical coding was the logical next step in their corporate relationship. But it was a large number of registered nurses in the country and the lack of available opportunities, both locally and overseas, that fueled the growth of the medical coding businesses in the Philippines. Due to the steady demand from first-world countries, the Filipinos' high regard for healthcare professionals, and parents who encouraged their children to take up nursing as a means to gain overseas employment, there has been an overwhelming surge in the number of Filipino nursing schools and nursing students in the Philippines since the mid-1980s. Throughout the Philippines, there are approximately 50 to 60,000 new registered nurses who pass the nursing licensure exam annually. However, since the global regression began in 2008, it has been very difficult to get nursing jobs overseas. This has resulted in a majority of Filipino nurses being either unemployed or underemployed. New nursing graduates have resorted to taking jobs that are way below their knowledge and skill levels. Jobs in retail and sales were their most common go-to jobs, until they discovered the BPO industry. With the boom of the Philippine BPO industry in the early 2000s, great demand arose for highly educated professionals who can speak English well and who have the intellect and the ability to learn new skills and understand processes. Once healthcare companies discovered that many of their Philippine customer service and back office staff were actually nurses, they started to migrate even their content-related processes to their Philippine offshore vendors. This signaled the establishment of the Philippines as a gold mine for medical coding and other highly skilled healthcare projects. Because of this, the Philippine medical coding industry began to gain momentum in the second half of 2011 and early 2012 when several American companies decided to set up office in Manila. One organization set up a 200-plus seater facility to train HCC coders, while another set up an offshore captive production facility as an extension of their Indian operations. From a few hundred coders in 2010, the medical coder headcount in the Philippines has risen to a current number of approximately 2,000 heads. This is made up of a mixture of CPC and CCS certified and non-certified coders. To date, there is an abundance of job postings for experienced and certified coders on print and online job portals. Many of the openings require CCS certification, but with the current suspension of the CCS examination by AHIMA, coding companies are opting to hire CPC certified coders instead. This has greatly increased the asking price of experienced medical coders, doubling that of newly trained medical coders, while coders with CCS certification ask for an even higher rate. Training of medical coders began as an in-house process, when the pioneer players started their operations in the Philippines. Typically, the best and brightest trainees were selected to go to the USA and sit for the CPC exam. Later on, one of the pioneer companies had a few of their senior coders certified as instructors with the AAPC, so that coders can be trained and certified internally without going to the US. Because of the large number of registered nurses, coder training institutions can filter admission into their training programs to those who have very good medical terminology and anatomy knowledge, and to those with adequate clinical knowledge, making it easier and faster for them to learn basic medical coding and greatly increasing their chances at passing the CPC certification exam. Success rates for the CPC exam in the Philippines have been very high, with a certification rate of over 95%. Cost of medical coder training in the Philippines is considerably less than coder training in the US. Training cost really depends on the duration of the program, inclusion of membership fees, examination fees, and cost of codebooks and other reference materials. Local training companies are currently investing on the development of their teams in order to increase the number of certified medical coding instructors. This will likely further decrease the cost of medical coder training in the future. One such training organization is TeleDevelopment Services Incorporated, which is currently cross-training their healthcare staff to include not only medical coder training in their portfolio, but also other high-demand healthcare projects such as case management, utilization review, customer service for healthcare clients, among others. Given the current state of the Philippine medical coding industry, there are numerous factors that need to be considered in establishing a medical coding group. The current supply of available experienced or certified coders in the industry. The size of the pool of highly skilled, highly educated healthcare professionals in the market. The cost considerations for inviting experienced or certified coders to transfer from their current employment, and the training and certification cost for fresh coders. For companies that intend to start a medical coding group in the Philippines, there are other things that need to be considered. If clients do not require certified coders, basic coder training of freshers can be done to achieve production quality and volume targets. This can be done in 4 to 6 weeks, depending on the quality of freshers hired for training. Once coders have obtained adequate on-the-job coding experience, they can be given review classes targeted for certification exams as needed. If clients require certified coders, freshers can be trained for production and to sit for certification exams. This kind of training can take anywhere between 8 to 10 weeks depending on the quality of freshers hired and on the specific requirements in production. There's no better day to join the Philippine medical coding industry than today.